Thank you for your time. Today I'm going to review a workshop that I have created for our staff to improve health literacy at Brownsville Memorial Hospital. As I was hired to improve the hospital's compliance with federal, state, and local regulations and to help the hospital to upgrade to a higher patient-centered medical home recognition level in about 18 months. So thank you very much for giving me this opportunity. And today I'm going to give you a preview of the workshop that I have created for the staff. My name is Rose Gerwig, and I'm the Director of Performance Improvement at Brownsville Memorial Hospital Community. What is health literacy? As you can see from looking at these 3 prescription bottles, could be, I think so. Is this what our patients see when they look at their prescription bottles? I hope not, but quite possibly this is true. Patients need to understand what their medications are for, what they're supposed to do, how to take them, and even how to store them. This information needs to be understood in advance so that we can be sure that patients are being compliant with their medications. Approximately 90 million adults have difficulty understanding health information that is provided to them by healthcare providers. The result is increased healthcare costs due to the use of emergency services and hospitalizations. This challenges even educated individuals who may not understand their health terms that are used by their doctors. It represents reading, writing, understanding, processing, and using health information. These are all what health literacy is. Areas of concern here. I've picked 2 main areas where there is concern. To begin with, clear communication with patients and providers is needed. Staff must create an environment where patients ask questions. This is very important. Here we have in this graphic a doctor engaged with his patient. They're smiling, they're happy. The patient is speaking openly to the doctor. This is the kind of environment that we want to have here. Clear communication is necessary to confirm that patients understand their health condition. We also need to ease the patient's fear of healthcare professionals using complex medical terminology. And clear communication will also empower patients to work with their healthcare providers to make decisions for their health. It is our responsibility as healthcare providers to promote health literacy and make sure patients understand their conditions, their treatment options, and possible side effects of treatments. Some information on our community that would be helpful to understand. More than 1/3 of our patients did not graduate high school. So are our providers giving information to patients that just can't understand it? They may not have the education level. They may not be able to read and write the way we would expect. 35% of our patients are foreign born and speak language other than English at home. Clear communication. Let's look at this graphic I've added. Average moods of a patient. Happy, sad, angry, depressed, in pain, tired, surprised. I've added confused. You can see the patients all look exactly the same. Can't really tell what the patient's particular mood is, but we don't want our patients to be confused, and improving health literacy will help us with that. We received poor ratings on the Press Ganey Satisfaction Survey, where patients and families found information provided to them was hard to understand or confusing. Patients must be able to understand the health-related information, especially due to less time spent with providers. This is necessary in order to make decisions about their health, to be included in their health care, and to be able to follow instructions without misunderstanding medical terminology. The goal of the National Action Plan to Improve Health Literacy of 2010, one of their goals is to promote changes in the healthcare system that improve health information, communication, informed decision-making, and access to health services. And that's what we're doing here. I have some suggestions to improve communication. To begin with, I would like to provide surveys before and after care to ensure patients understand their condition and treatment options. Before the visit, patients will complete a short survey inquiring about the reason for their appointment. Do they even know why they're there? This will confirm that patients know in advance that things have been explained to them, whether they're there for preventative or for treatment of a disease or a condition. And then upon departure, another short survey will confirm the understanding of the information provided. It can confirm if additional questions need to be answered by the patient's physician or healthcare provider. The survey will also be helpful in establishing that improvement was made in our efforts. So if the survey responses say they don't fully understand, or they understand 60% or 70%, or on a visual scale, where their understanding lies, is it at 100%, 50%, at less? Then we know if perhaps our nurses who are working, if they can have some downtime during their day, they can maybe reach out to patients, or our health education office can contact patients to answer questions that they might have. Another suggestion is to train providers to help them understand how to better communicate with patients through the use of clear, plain language and avoiding jargon, use of visuals, and the use of the teach-back method. Teach-back method where physicians or healthcare providers explain something to the patient and the patient has to explain it back to the physician. I've also created an exercise for the providers and patients to complete during visits to confirm information is understood. And during this workshop, we are going to complete this exercise in small groups. How to communicate clearly with patients. So this was discussed briefly on the previous slide, but we're going to talk about what needs to be done. So avoiding the use of jargon, medical terminology that is complex, and acronyms that patients don't understand. Use visual tools like cartoons, wall diagrams, and anatomy models. Sometimes the anatomy models come apart and they can be put back together. Know your audience, talk to them. Read their completed forms to see what their ability to write is, whether they can write clearly, whether they make errors in spelling of very common simple words, whether perhaps they're not completing the surveys or the questionnaires at all. Perhaps they are not able to write or read. And when we provide written communication, it needs to be in clear, plain language. It's recommended that any communication that's distributed to the general public be the 5th to 8th grade reading level. Also, the use of appropriate translations and common language is used by our patients. So right now, we only have English translations. It would be beneficial to offer perhaps in Spanish or in Chinese, where we also have large communities who speak those languages. And also use the provided translators and interpreters who will communicate providers' message to patients and patients' questions to providers. It's also important for us to create an environment where patients ask questions. Our survey results indicated that patients don't know how to act on information provided by the provider. Why aren't they asking questions? It could be that they're trying to be polite. Maybe they're scared of asking dumb questions. Or the lack of understanding of anatomy and basic healthcare may make it difficult for them to even know what questions to ask. The goal of the National Action Plan to Improve Health Literacy 2010 is to make patients become active learners. So making sure that they engage in learning the material that is provided to them by their physicians. Asking questions improves the patient's ability to follow the instructions. This is patients asking questions. Providers should encourage patients to ask these questions. Here are some suggestions to promote this. Encourage patients to ask questions by anticipating or verbalizing common questions. Provide patients with notebooks and pens to write down questions they may have. I have ordered and will be distributing at the workshop to all of our staff promotional notebooks and pens to be provided to patients with the Brownville Memorial Hospital logo on the cover, as well as the title, Questions to Ask My Doctor. So patients can use this notebook. They know exactly what it's there for, and they can take that home with them, write their questions down, use it when they receive a phone call from the nurse, or they can write their questions down while the doctor's explaining to them something, or while they're waiting. Also, it's important to give patients time to discuss the information and discover what questions they have to write down in their notebooks. It's very useful to give them a few minutes, give them the opportunity to take any information home and follow up with them. An initiative called the Ask Me Free from the Partnership for Clear Health Communications at the National Patient Safety Foundation of 2007 encourages that physicians make sure that three questions are asked by patients. So this may mean coaxing them, encouraging them to ask these questions. First, what is my main problem? What do I need to do? And why is it important for me to do this? I have created this engagement exercise to do at the workshop with the staff. It's a simple exercise, and I would like to see it used by providers with their patients to make sure that information is understood. It is a jigsaw puzzle exercise to promote better understanding of information. Patients, caregivers, and healthcare providers will discuss the pieces of the puzzle to cover pertinent information while assembling the puzzle. Each piece will represent another topic which needs to be discussed. When all areas are discussed, the puzzle will be complete. The exercise can be repeated by all members of the discussion to ensure that the information was understood. The purpose is to encourage patients to learn a way to understand all aspects of their health care and to be able to follow instructions provided through an easy, informative activity that will help organize the information in a retainable manner. The key areas of concern are addressed. So each large jigsaw puzzle piece will contain a category of information, the name of condition, including other words used for it. So for purposes of our workshop, everybody is going to understand hypertension. So the cards are going to say high blood pressure because patients are not going to understand necessarily what hypertension is, but we'll add it onto the slide or onto the jigsaw piece so they can see what other terms might be used in their reading to make sure that they become familiar with all of the commonly used terms for their condition. Also, body parts body parts and organs involved. A brief description of what the challenge is or what the condition entails. The treatment method, so whether it's a pill, infusion, or injection. Specific treatment dosage and duration. Possible side effects. When to seek further care and what to do differently. The healthcare provider will prepare the puzzle in advance of the patient visit. This should take the healthcare provider about 10 minutes. During the visit with the patient, the healthcare provider will hold the pieces and hand one at a time to the patient to fit together in the puzzle. When the puzzle is complete, the patient has heard all of the necessary information. The provider should then disassemble and let the patient repeat it back and reassemble the puzzle. It can be repeated by patients, caregivers, friends, family members to ensure that all understand the treatment and the condition. For purposes of the activity with staff, they will split up into groups, and they will have one healthcare provider, one patient, and a third possible person could be a family member. So what's needed for this exercise? It's pretty simple. A reusable jigsaw puzzle with dry erase layer on both sides, and a medium point dry erase marker in different colors. The role play exercise is in groups of 2 or 3. Each group will receive the jigsaw pieces, and the health provider will explain to the patient. They'll assemble the jigsaw pieces and then put it together when the information is collected completely, and then the roles can be reversed. So the healthcare provider in general will be able to prepare the jigsaw puzzle pieces in advance. I have already prepared them for the workshop. The information should be kept brief, but don't skimp on the necessary details so you can use both sides of the puzzle pieces. Sit down with the patient and caregiver and discuss each piece in full. Engage the patient by handing each piece to him or her after the details are discussed. Patients should be encouraged to fit the pieces together as discussion moves along. After the puzzle is fully assembled, patients should take it apart and then teach it back to the provider, putting the pieces together as the discussion moves through. This activity should take about 10 to 15 minutes. It's expected that providers will use this exercise to engage patients and educate them on their condition. The final step in the exercise is to confirm that the patients know when to seek further medical care, whether they need to call the emergency room, when to call for an appointment. Providers should always follow this exercise with a handout of the information covering all categories in plain language. For the training exercise, I would like each group to complete an evaluation, letting us know what they think about this activity. Thank you so much for your time. I welcome any questions you may have.